Hi there, welcome back to Amaize Health as we continue the journey to amazing health. I'm Dr. Thorpe Amaize. Thank you for joining me today. So, keeping with the same theme of discussing the doctor's appointment, I wanted to address medical release. Navigating the healthcare system can be difficult for most of us. And one of the sources of frustration for many patients is showing up at the doctor's appointment after being told to follow up with their primary care doctor, only to find out that the primary care doctor was not aware of their hospitalization nor have any record of it. So, if this has happened to you or someone you know, let's address it. If your primary care doctor is not in the same health or hospital system where you were evaluated, they will likely not have those records. The purpose of completing the medical release form allows a third party, in this case your primary care doctor, to access your medical records where you were seen. Just saying someone is your doctor doesn't automatically give the hospital the ability to share your information with that person. This would be a violation of HIPAA, which protects your health information. HIPAA protects the privacy and security of your information and also has a process for notification if, for any reason, that information has been compromised. Also, note that this consent that you provide through the medical release form can be revoked or reassigned to another provider at any time. What you are provided with after a hospitalization, a urgent care visit, or other visit type is typically called an after visit summary. This after visit summary may be helpful to relay your medication list and some other information like vitals, but it's usually not the information we're referring to when we ask for your medical records. Typically, a medical release request has to be completed either at the location where you were seen or at the doctor's office that needs it. If you are completing it at the hospital, it is best to do this prior to or upon discharge so that the discharge summary can be sent to your primary care doctor. This usually requires knowing your doctor's name and or fax number or address. Most often, after discharge, you are not thinking about this. So, if possible, have a loved one assist you. Otherwise, you can fill out a records release form at your doctor's office, which is then faxed to the hospital or the location where you were evaluated. In both scenarios, you need to be present as it requires your signature. Otherwise, a healthcare power of attorney can sign for you. This will be helpful so that your doctor can understand the events that happened while you were hospitalized and note any medication changes that may have been made. Another scenario where medical release form should be completed is when you are changing to a new primary care doctor. Your recent lab work, imaging such as a CT, MRI, or X-rays, a colonoscopy, a mammogram, and at least the most recent progress note should be included in the request. This will help your new doctor understand what results needs to be further addressed and what additional testing, if any, is required. This will help to prevent repeating tests. Our goal is to provide you with the best care, and having all the relevant information will assist us in doing just that. So our takeaway points for today are: an after visit summary is not the same as your medical records. You need to complete a medical record release either at the location where you were seen or at the doctor's office that needs it, and both need to be signed by you. A medical release form can be revoked or reassigned at any time. You can read more information about HIPAA by connecting directly to the website below. A reminder: the conversations that we have here are not to replace going to your doctor, nor take the place of your doctor's advice and recommendations. Come back again next week and we'll continue the conversation. You can connect with us on social media platforms such as Twitter and Instagram at Amaize Health or the website www.amaizehealth.com. I will continue to discuss health related topics on this YouTube channel, and as you listen, be sure to like and subscribe. Again, this is Dr. Thorpe Amaize with Amaize Health. See you next time.